Sometimes the position of the condyles here changes. That changes the bite. Question is that a good thing or a bad thing? My name is Costin Marinescu. I'm a dentist, originally from Romania. Then I traveled to the United States and I lived there for quite a long time. I got my training there. And 5 years ago I moved to Munich, so I practice in Munich right now as a prosthodontist. This is my first time visiting Budapest, so I'm looking forward actually tomorrow to take a tour of the city. So the lecture that I gave today in the Dental Forum here in Budapest is about aesthetic risk and functional risk. We all are challenged nowadays with requests from our patients about aesthetics. They want an aesthetic improvement of their smile, mostly because it's very emotionally charged and socially very important. But is that working also from a functional perspective? That's the real question. And actually, even taking a step back, I'm looking at every patient, trying to understand why are they asking for that aesthetic improvement in the first place. Does that have to do with tooth wear, or does it have to do with tooth movement? Usually those happens because of functional imbalances or because structural damage. So unavoidably, I always get to a functional evaluation, and then to the need of understanding how did the patient get to that point in time and why is he requesting what is requested. I think it's very important, maybe more than ever, because we have a lot of noise in dentistry. We have a lot of technologies. We have a lot of tools, a lot of toys that dentists like to play with. You know, dentists are trained to use tools, so they're very good craftsmen. There are a lot of toys nowadays that they give you a lot of resolution. There are a lot of details. What do they mean, those details? And that brings me back to what Goethe said, we see only what we know. And in medicine, we treat only what we see. So that it's really important to understand first what happens, how did the patient presented with the situation there is right now, how their life is, how they live, how they chew, how they breathe, and then use the technology when it's necessary to add resolution or confirmation of what we actually discover through our knowledge. My workshop is about discovery. It's actually, I'm trying to change the way dentists look at themselves, to realize that, you know, every dentist has teeth. So what we're going to do is going to mount models in articulator. They're going to take a bite registration. They're going to mount those casts with that bite registration. So it's their own models. And what they'll do, they're going to wear a deprogrammer. They're going to work an anterior bite plane overnight. They're going to make themselves and see if the bite tomorrow is the same like today. Because the study shows that anterior deprogrammers allow the muscles to relax, and sometimes the position of the condyles here changes. That changes the bite. Question is that a good thing or a bad thing? So all I'm trying to do is provoke them in asking more questions. And this is the first step on the path of discovery. I think the Dental Congress in Hungary is really nice. I mean, it's very well organized. My good friend András Folom, he invited me, and it's really good to see him again. We met before in Munich before that. And I like it. I can't wait to go in the stands and actually take a look at all the toys.